We're here today to announce significant extensions and expansions of existing aged care support programs initially announced in March and subsequently as part of the National Aged Care COVID Plan. In particular, the Australian Government will invest $563.4 million in extending and expanding these programs that have been in place to support aged care facilities, to support aged care workers, and I want to particularly thank and acknowledge them for their work. And I also want to note that that will assist with the single site worker program and also providing support for aged care residents where they and their family wish to care for them on a temporary basis at home. Let me begin by noting more broadly that the world has passed 25 million cases, very sadly, as we predicted last Thursday. 25.1 million cases and rising, and 845,000 lives lost. And here at home, 25,746 cases and 652 lives lost. And we grieve all of those that were announced today. Those 8 that were lost in in the last 24 hours, and the 33 that were identified at our request as part of the data search which we requested of Victoria, and we thank them very much for this over previous periods. And we think that that is an important process. Whilst all of these had been acknowledged through the births, deaths and marriages process, we wanted to make sure that they were recorded in the Victorian Public Health system, and that as a consequence we were able to acknowledge, to respect, to identify all of those who have lost their lives to COVID. In terms of those in hospital, there are 481 Australians in hospital, 27 in intensive care and 17 very ill Australians who are on ventilation. In addition, 6.214 million tests have been conducted, and at the same time, Professor Paul Kelly will provide an update on the epidemiology and in particular the trends over the last 7 days. I would note that across Australia there have been 84 cases today. In 5 states and territories, 0. In Queensland we have 1 case, and in New South Wales 4 cases in the community and 6 in hotel quarantine. In Victoria, 73 cases, a lower number than has previously been the case and consistent with a general downwards trend, and we welcome that. That's a very important moment for Australia, as well as Victoria, as well as my home city of Melbourne. In terms of the measures, I'll briefly outline, and then Senator Colbeck will outline in more detail. The 4 measures are, firstly, continuation of the COVID supplement to provide for an additional 6 months to the end of February 2021. This is support for facilities, and it comes at a cost of $245 million. It assists them, as we announced in May, on the 1st of May, with the ability to develop their workforce, to provide for PPE needs and for other elements relating to the fight against COVID-19. Secondly, we'll be extending the support for aged care workers in COVID-19 areas to operate on a single workforce basis. That will be extended as an entitlement from previously 8 weeks per facility to 12, and is always subject to review if required. And the program itself will now be extended as an available option until the 30th of June 2021 at an investment of $92.4 million. Thirdly, we will be expanding the short-term home support for older Australians who are on leave from residential aged care, the ability for families to care for older residents who will take time away from an aged care facility, and that will be extended until June 2021 at a cost of $71.4 million. And then fourthly, the extension of the COVID-19 aged care workforce retention payment. And this continues on the $235 million measure announced on the 20th of March 2020 as part of our National Aged Care Response Plan. In particular, that will involve an investment in supporting our aged care workers of $154.5 million. As I said at the outset, all of these measures together will constitute a $563.4 million extension and expansion of our support, taking total Australian investment in COVID-19 aged care support to $1.5 million. All of these things come together with a very simple goal: to save lives and protect lives within our aged care facilities and across Australia. We know, when we look at that figure of over 25 million internationally, that this is a global pandemic which will likely continue at close to 1 million cases diagnosed every 4 days for the foreseeable future. And with that comes the heaviest of tolls. We have overwhelmingly avoided those tolls in Australia, but we are seeing in Victoria an agonising loss. So this will help Victoria continue to fight that. It will help us continue to fight that and to protect our older Australians with every fibre of our being. Richard?
Thanks, Greg. So to the measures that we're announcing today. The first one is a continuation of the COVID supplement that we rolled out, announced on the 1st of May this year, and that's an extension of a one-off payment to be made to all residential care providers in October of this year, $975 per resident in metropolitan areas, that's MMM1, and approximately $1,435 in all other areas, MMM2 to 7. It also proposes that the temporary 30% increase in viability supplement for both residential and home care and the residential homeless supplement be extended for a further 6 months. And that provides extremely important support for providers, particularly in those areas where their residents are more susceptible, or in Indigenous communities where we know that aged care is particularly important, but also that those communities are very susceptible as well. So that support continues out to all of those that have higher costs, and we recognise as having high costs as part of their service delivery. Those provisions will be subject to a number of additional reporting requirements. They'll be required to have a designated infection control officer on site as a part of their upgraded COVID-19 management plan. They will be required to report their additional costs with respect to supporting residents with communication with their families, and also they'll be required to report on other things like the costs that they have around screening of residents, screening of visitors, and of course their staff as they come and go. So this payment is in recognition of those additional costs, but we will be having specific reporting requirements that will be made against those additional costs to the Commonwealth in their annual reporting cycle. The next proposal is the support for workers working on one site, particularly in Victoria, and that's $92.4 million. The grant program will be extended out until the 30th of June next year, bearing in mind that most providers will claim this in arrears as they fully understand their costs. And as Greg has said, the period of time for the program, which was initially negotiated between the unions and employers for 8 weeks, we will extend out to 12, just acknowledging the circumstance of the outbreak in Victoria as it stands at the moment. One of the things that we have done during this process, and a number of families have decided to do, is to take their family members out of residential aged care, and we've been funding that to this stage through some of the program funding that we've had available. We've made a specific allocation of $71.4 million to this program that will support older Australians to go home if that's what they and their families decide that they want to do. There will be 2 tiers of funding that will be available, and we will make, if we need to, this program available to other parts of the country in the circumstance that they do have a designated outbreak within their region, and we will advise the circumstances and the criteria for that once those details have been decided through the CMO. But this does provide the opportunity for those people who are concerned about their families remaining in an aged care facility where there's a COVID-19 outbreak. There have been quite a few that have gone home, including, I might add, some residents who are COVID positive have gone home to their families. And in recognition of the pressures, the genuine pressures on the workforce, we've decided to extend the workforce retention program for a further round. So there will be a further national round of the workforce retention bonus. It will be based on the same guidelines that we applied in the first two rounds, and that will go out and be based on those who are still in employment at the 30th of November, and it will be based on exactly the same claims program that we've had for the previous rounds. But one of the things that we have seen through this entire process is that very many workers have been reluctant to come to work where there's been a circumstance of COVID-19, and I've even seen a survey where in a site where there is no COVID-19 outbreak, a significant proportion of the workforce have said if there is, they won't come to work. We need to send a message to our workers in residential aged care that they are very important. They are important to us. They are important to the people who they work with, and this is one of the ways that the government is seeking to do that in acknowledgement of the fact that we need our aged care workers to come to work. The people who are in the residential facilities rely on that, we rely on that, and the care that residential aged care residents get is dependent on that.